We're probably going to go overtime here a little bit, so we'll alert folks back at the station.
I think we expected that.
Yeah. Anyway, there's first of all kind of a two-part question here, so we'll work through this. A lot of concern about obviously the health care reform. The public option, is it on the table, off the table? If it's not on the table, is reform going to work? Senator Thune, let's start with you.
Well, first off, healthcare reform should be about reducing costs, not increasing costs. And every proposal so far that's been produced by the Congress has increased costs. They call it bending the cost curve, and they are bending the cost curve instead of down. It bends the cost curve up. So we're spending more on healthcare rather than less. And of course, when you spend more, somebody has to pay, and the people that are going to pay are either the providers and the people who benefit from Medicare in the form of reductions in Medicare. I mean, really think about it. There are three ways you pay for this. You reduce spending, which in what they're talking about is making reductions in Medicare. Two, you raise taxes, and there are tax increases in all the proposals that are out there. Or three, you borrow from future generations, which, as I said earlier, to me is not an option. I mean, we're going to have a $1.8 trillion deficit this year, which is the largest by about 4 times in American history. We haven't seen deficits like this since the end of World War II. So we have to get our fiscal house in order, and that's why any healthcare reforms need to reduce or constrain costs, not increase costs. And everything that we've looked at increased costs. Now, incidentally, you talked about the public plan option, which I refer to as the government plan, is all 4 committees that have acted so far in the Congress, and there are 5 committees with jurisdiction. The only one that hasn't reported a bill yet is the Senate Finance Committee, and that's expected sometime in September. But of the 4 committees that have produced bills, all 4 of them have the public plan option in them. They have the government plan. Now, you have to believe that the government can do a better job of running health care. I don't. I think that if you look at historically, when the federal government tries to do big things, it doesn't do them very well. We have recent examples of Freddie Mac and Fannie Mae, the Katrina recovery, all those things where you've got big projects. The federal government has not proven itself to be very good. And that's why I think people are so upset about this, because health care is very personal to them. It represents 1/6 of our entire economy. And before we hand over 1/6 of our entire economy to the federal government to run, we better think long and hard about it. But I don't want the government. I don't want a European system or a Canadian system, and I don't think most Americans do. But of the 4 bills so far, so far that have been produced by committees in the Congress, all 4 include that government plan, and all 4 of those bills call for new revenues to pay for the increased costs in the form of tax increases or reductions in Medicare. And so I just think that if we're on the current path or trajectory we're on today, this is not something that I think most Americans want to see happen. Now, there are things we can do that would reform and bend that cost curve down. And I hope if we have a debate about this in the Senate eventually that we'll have an opportunity to provide some alternatives and some amendments that do that. But I'm very concerned about the path this is on, because it would do to the American economy. It would kill jobs. National Federation of Independent Business said in the first 5 years that this bill is implemented, it would cost the economy 1.6 million jobs. It kills jobs, it raises taxes on an economy in a recession. It potentially borrows from future generations at a time when we're running trillion-dollar deficits as far as the eye can see. This is not a good thing for the American healthcare system. It's not a good thing for the American consumer or patients, because you start having the government get in the way of the relationship between you and your doctor. And I don't think most Americans want to see that either.